Shoulder arthritis can be quite painful. What it entails is where you have the shoulder joint with the ball and the socket, the thick layer of cartilage that acts as a padding on those surfaces starts to wear away, and then you can approach to a situation where now you have bone-on-bone articulation, and that's arthritis. Shoulder arthritis specifically creates a significant amount of pain deep within the shoulder. This can be worse with any type of motion, especially motion where the hand or elbow are further away from the body, such as trying to fix your hair, get something out of the cupboard, reaching your arm away from your body to get dressed, and doing anything quick, such as throwing a ball. Shoulder arthritis can be quite debilitating, but oftentimes does not require significant or serious interventions to make it better. Oftentimes, shoulder arthritis can be significantly improved simply by physical therapy to try to get the range of motion back and to stretch the shoulder, prescription strength anti-inflammatories to help the inflammation calm down, cortisone injections as well to help get the inflammation to calm down and to affect pain relief. If that's not effective, there are also options for arthroscopic debridement, to simply clean the shoulder out to get some of the broken off pieces in the shoulder out of there to allow the patient to have better motion, better function, and much fewer symptoms. And then also in the rare instances when that's not enough to alleviate someone's symptoms, we can also proceed with a shoulder replacement. And these are very successful operations where the patient typically stays for less than 23 hours in the hospital, is in a sling for just a short period of time, and is often back to full activities within just a very few short months. So if you are experiencing shoulder pain that may be shoulder arthritis, please give us a call so that an experienced orthopedic surgeon can evaluate your shoulder.